Everyone, thank you so much for coming. Today I am very pleased to announce that Hamilton County has filed suit against pharmacy benefits pharmacy benefits manufacturers, as well as drug manufacturers, for unlawfully increasing the price of insulin and other diabetes medications for years. My office has retained the services of Young & Partners to handle this magnitude of a lawsuit. They will be working for us on a contingency fee basis, which means that they don't get paid unless and until we win. So there will be no cost to the citizens of Hamilton County. But this litigation could seriously help a lot of people in our community because they've been getting ripped off. It's no secret that insulin prices have risen, but the severity of the increase did not come to my attention until last summer as I was doing some research. And in the course of my research, I saw that litigation was filed in other parts of Ohio as well as in different parts of the country. In my mind, we needed to help the people in our community in some fashion. And this was one solution that I came up with. So I approached each of the commissioners to gauge their interest in this sort of litigation. And I think they're here to tell you what their interest and their decision was. Commissioner Summer-Odumas.
Good morning. Stephanie Summer-Odumas, President of the Hamilton County Board of Commissioners. To me, it's clear as black and white that this should have happened a long time ago, and I'm so proud of our prosecutor who brought this forward and shared it with all three of us. We're here today because Hamilton County is taking action to protect our employees, their families, and taxpayers. The cost of insulin, as was said earlier, a life-saving medication, has been around for many, many decades. It's skyrocketed as far as the price, placing an unfair burden on our people. And you know this board is really into trying to make sure that everything is fair and equal as much as we can within our power. Drug manufacturers and middlemen have driven up the prices, forcing counties like ours to pay more for medications people need to survive. Fortunately, I don't need it, but I know people that do, and there are many millions of people that do. Today, we are announcing that Hamilton County has filed a lawsuit to hold these companies accountable. The lawsuit comes at no financial risk to the county taxpayers, as was said earlier. The firms representing Hamilton County are working on a contingent basis. This is about being responsible stewards of the taxpayers' money and pushing for a health care system that puts people before profits. And now I'd like to introduce Vice President Reese.
Thank you very much. I want to thank Prosecutor Connie Pillage. When I got the phone call from her and the research that she and her office had done, I was on board immediately like my colleagues. And as was said earlier, this is something we wish we could have done earlier, but we're in the game now. We're standing up for the taxpayers now. Some will ask, can this really be done? There were some that asked the same question about the opioid crisis, and Hamilton County was in the forefront and won these lawsuits and now is helping people. Let me just say that according to the CDC diabetes data, 11.4% adults in Hamilton County, that's over 100,000 people, approximately, have been diagnosed with diabetes in our county. 70% of them have to take insulin in order to live. We're talking children and babies. We're talking working families. We're talking senior citizens. And we're talking everyday workers as well as workers who work for Hamilton County. Our 513 relief bus, which has gone out and helped over 50,000 people, we are on the bus taking diabetic tests at no copay cost. And we're running into hundreds of people who have gone up on their, what they call sugar levels. We have helped distribute strips to help test the diabetes, to help diagnose them with early detection. But then there's the next step. If they go to the doctor and they say they have to have insulin, how do they pay for it? And so the cost has gone up, and it has impacted even us here at the county with a cost of almost $13 million because we have over 8,800 county employees who need the insulin. So this is not just about our employees, but this is about all of the folks in Hamilton County, over 100,000, who've been diagnosed with diabetes, with 70% of them needing the insulin in order to survive. So this lawsuit is more than just a lawsuit. This is a life and death situation, and no one should be priced out of being alive when we know that there's insulin that's available to keep them going. Now, I've experienced this personally through family. I've seen what the cost, how it has jumped, and what people have to make decisions. Do I get the insulin or do I get my groceries? And I've seen my neighbors talk about it, everybody you run into. You go to churches, we've got this diabetic problem. This can be solved. People can live, but they can't live if you price them out the box with the insulin. So I'm happy that, prosecutor, we stand with you on this. We're going all the way on behalf of those in Hamilton County who've been diagnosed with diabetes and have been priced out with the cost of insulin. So at this time, I'd like to introduce County Commissioner Denise Driehaus.
Thank you. Good morning. So I, too, want to congratulate and thank Prosecutor Pillage for bringing this to our attention. Prosecutor Pillage has taken a very aggressive approach to her position here in Hamilton County, and we are benefiting from that. And so we stand here in partnership with the prosecutor, with my colleagues, to say yes to standing up against these corporations and standing up for the taxpayers in Hamilton County. So I'm very proud to be here in solidarity with all of you. So a small number of corporations control most of the insulin market, and families are paying the price. 3 companies control 96% of the global diabetic drug market. 3 companies control over 80% of the pharmacy benefit manager market, affecting more than 270 million Americans. The level of consolidation allows prices to be driven up with little transparency or accountability. So we are standing up to those corporations and standing with our community. Life-saving medicine should be accessible and affordable. It should not be a luxury. And I, too, am reminded of when we went after the distributors during the opioid settlements. That was a challenging time, and it was a different look for us here in Hamilton County. We had not done that kind of thing in the past, but we knew we needed to do something to get that under control. And so we sued, as Hamilton County, the city of Cincinnati sued, many of the jurisdictions around us sued. We, in the end, collaborated with the state of Ohio, with the governor and the AG, to say we're going to do this together to make sure we get some benefit for the citizens of this community who are suffering from addiction. And so we did that, we were successful, and now those dollars are coming into our community and helping people on the ground get people into long-term recovery that suffer from addiction. I see this in a similar way, where we are going after kind of the big guys in the hopes that we can provide some relief for people that live in this community and Hamilton County taxpayers. So I'm very proud to be here, and with that, I'm going to turn it back over to Prosecutor Pillage, because I think it's Q&A time.
All right, James.
First question's for you, Prosecutor Pillage. I've seen where this is actually, these suits have taken place in other cities and counties. Do you know, and if so, how much? And then the follow-up is for the commissioners. If indeed it's successful, where does that money go? What would you use that money for?
Well, first of all, I don't know of any settlements. I haven't found any yet, but that doesn't mean one doesn't exist elsewhere. But keep in mind that these types of lawsuits do take a lot of time. I mean, our complaint that we filed was 280 pages long. something like that. So it's very complicated and complex against multiple defendants.
Just real quick, is there a specific dollar amount that you guys are asking for, or are you just asking for unspecified damages?
Right now, we ask for unspecified damages. That's the custom in the first complaint that you file.
Is this a class action suit, or what you described?
No, it's the county. The county has authorized us to file this suit on behalf of the people on the county payroll. We do assume that as more of these lawsuits are filed, that some of these defendants are going to start to take notice and realize that it's not worth ripping us all off, and that they should lower their prices for everyone. So that's why I say this could help all the people in Hamilton County.
I would just say that the previous money that we received from the COVID lawsuit went into our general fund. I am assuming that we would do the same, but it would be up for discussion.
Can I add, I think one of the things we want to do, though, is to send a message to drive the cost down. So in other words, if you're doing business in Hamilton County, when grandma and the grandkids have to go to the pharmacy, that cost is driven down. This could be a national model started right here in Hamilton County, and that's why I'm thankful that our prosecutor, we stand firmly with her on this issue. This could be a change from the price gouging to getting affordability, and I think this is an affordability fight.
Just as to follow that model, you could use the money to supplement the cost for individual citizens, for example. Is that kind of what you're thinking?
No, that's not yet. We want to first get the cost down. So when you go in, your cost is down. And then obviously if there's a settlement money, we'd have to get together. But I think the first thing is we want to get the cost. When you go to the pharmacy, the cost is down. And that's, to me, one of the things that we're trying to do, change the cost structure.
Commissioner, are you putting pharmacies on notice?
Me? I would say that, yes. We want the pharmacies, we want the cost down for the citizens and for the taxpayers. Yes, I think that's one of the reasons that we're here, because you have to go to the pharmacy to get the insulin, but it has to come from everybody above the pharmacy to get it to the pharmacy, to get it to the consumer. And I see this as a major consumer fight, and we're standing with the taxpayers and the citizens of Hamilton County, the consumers.
So prosecutor, according to what you said, you saw this was happening and you approached Young. They didn't come to you to ask to be a part of this. You did the research and reached out to them.
I do know that I was aware of them. I don't remember exactly the sequence, but I became aware of them sometime last summer. Then I did some research, consulted with my staff to see if we could handle this ourselves. We don't have the resources to manage this large a case. So then I went back to Young and Partners.
How many other clients do they have, or what number is the county on that?
I have no clue. I do know that somebody has filed lawsuits in, I think, 6 other counties in Ohio. I'm thinking Elyria, Summit, Cuyahoga. I don't have it with me right now. So.
Class action?
No,
No.
it doesn't qualify as a class.
How many, I haven't seen the release yet, so maybe it's not, but how many companies are you suing, and what are their names?
Oh, gosh. It's in the press release.
Is that easy?
Oh, okay. So we have Eli Lilly, Novo Nordisk, Sanofi, CVS Caremark, Express Scripts, and Optum RX. Those are the first 3 are the manufacturers. The second 3 are pharmacy benefits managers.
Are you going to be seeking violations under the Valentine Act, antitrust laws, or how will this be?
I'm not sure I can answer that right now, but I can get it to you later today.
Because it's the manufacturers and the pharmacy, is there an idea that they were colluding
Together to artificially inflate the cost of insulin for many, many years It went up very quickly in relative terms. And keep in mind that not a single one of these pharmacy manufacturers invented insulin, or developed it, or patented it, or had to pay for the patent or the use of it. Not a single one. This was, insulin was, I don't know what the correct academic word is, but it was invented in the 1920s, and a patent was sold for $1 because the inventor believed that this drug was revolutionary and would save the lives of many, many people, and it belonged to the people.
And this is different than our COVID lawsuit because the COVID lawsuit was over distribution and small entities are just spending more than they should. This is more collusion.
Yes, ma'am.
You said this could take a while. Do you have a timeline on when Hamilton County residents could possibly see relief, whether that's lower costs in the pharmacies or a possible settlement?
Well, in law, we say it, pardon me, in law, we say it takes as long as it takes because we're working with the court. We're working against large corporations who will flood us with paper, and that takes a lot of time to respond to. And you never know what other obligations a court might have, how busy that judge's docket is. So sometimes it just takes a long time.
Commissioner Dumas, I just want to be clear, you said COVID a couple times, you meant opioids and
Okay, thank you for correcting me, you're right. Yeah, yeah,
Yeah.
thank you.
Yeah, look, I think this would be very, very helpful to the people, everybody who lives. Thank you all, y'all were so nice to me, thanks. Oh, I didn't notice it.
I'm not gonna.